when I'm invited to the conferences, I'm always thinking, what will you like to hear? What is it that you as caregivers and patients living with MSA would like to learn? And it's challenging because everyone's needs are different. Everybody's at a different stage. Maybe you're just being recently diagnosed, so you're not sure what you need. Maybe you're in later stages and you have more challenges to address. So I just want to let you know that when putting together this presentation, I try to put something together where there is something for everyone, I hope. So there could be things that are very basic. There could be things that you already did that you have gone through, and other things that maybe you learn. I can only hope. The in going through through the slides, I'm going to be doing a lot of definitions and things like that. So obviously, I'm not going to get into details on those things. But I do know that by giving definitions and by acknowledging resources, I understand the barriers that there are out there. So when we talk about Social Security, disability, Medicare, Medicaid, home care, all those things, I know that it's not as easy as just getting them. It's a process, and we get through denials and things like that. So I want you to know that I'm aware of these things, and I'm careful when I talk about it. So when I was putting together this toolbox for prevention and management, I think the first thing that came to mind is we need to have a strategy, like with anything else. When you have a challenge, when you get a new job, there's got to be a strategy. And one of the key elements is to have a team. You want to be surrounded by people that can be a support network in your life. So yes, so you have your primary care physician. Hopefully, you can get to a neurologist who specializes in the diseases of the nervous system. Hopefully, that neurologist can also tell you, if it's evident that you have a movement disorders condition, that can provide more expertise. Hopefully, a movement disorders specialist that is affiliated with a major university or a teaching hospital that has more access to the cutting knowledge on treatment of movement disorders. The neurologist, the movement disorders specialist, should be hopefully also referring you to a nurse, to a occupational therapy, a physical therapist. There might be a nurse specialist as well that's working with your neurologist, or a movement disorders specialist, or a nurse practitioner. So you can ask for those members of the team when you go to visit a neurologist or a movement disorders specialist. Sometimes they have as well social workers like myself. I work with a movement disorders specialist. Um, Sometimes when you go to your visit to the movement with the neurologist or movement disorders specialist, you're not asking for specifics. You're just sort of telling what symptoms and what's happening. And the physician at that point might not think of, maybe a social worker can help with that. Maybe something that doesn't come across. But if you know that these are people that can be part of that team, hopefully when you go visit that neurologist, that movement disorders specialist, you can ask, what about referral to occupational therapy? What about referral to physical therapy? Do you have a social worker on the staff that can guide me through the process of getting this equipment approved? Things like that. So knowing your team, building that team, it's really essential as part of the strategic planning of, navigating life with MSA. So I went through some definitions as to what they do. I think physical therapy and occupational therapy, they work together. Main difference with the physical therapists, they want to maintain the highest level of functional ability. They improve mobility. They focus on reducing the risk of falls. They work with pain management, and they develop very specific plans with outcomes that can be measured in terms of progress of their work. And they focus on the motor skills, or gross motor skills, which is what the word that I was looking for. And the occupational therapists, they're working with fine motor skills, so things such as getting dressed and getting in bed safely, getting out of bed safely, and they work on a person-centered approach. They're looking as to where you live. Let's take a look at your home. These are the people doing the home safety assessments, right? Let's go to your bathroom. Let's see what's at risk in there. How can we address that? Let's go to your bedroom, like Dr. Dupree was mentioning, right? What risks are there? Is there a night table, a lamp that could be a risk if you're suffering from REM disorder or anything like that? So they're looking and focusing on safety. Um, and the social worker, we're there to help you navigate the journey. We're there to help you with resources. We also take into consideration the emotional impact that the disease has on you and your family. So we are addressing the comprehensive needs and hopefully providing you with valuable information as you build that safety net and that team. Know your resources, plan ahead. That has to do with self management, that has to do with prevention. um, there are certain things that are important that we need to do before we're in a state of crisis. So, yes, for example, we need to apply for Social Security. Maybe most of you already have it. We know that MSA is under the Compassionate Allowance Act, which was passed in December of 2011. The Compassionate Allowance for Social Security allows you to get Social Security within a faster rate than regular Social Security. Once you put the application in, you can begin to get services within 2 weeks to 2 months. It depends, but it could be really fast. The only thing that hasn't changed in terms of benefits, Medicare is still kicks in only after 24 months of the date of the application. So that's something that is still is policy that hopefully with our advocates in Washington and policymakers is something that hopefully we can change and strive to change because we do have to wait 24 months until Medicare kicks in. So something to think about is how do I keep my medical benefits? How do I make sure that I'm being covered during that time? um, Applying for Social Security is like any other process. It's important that you collect your medical information. It's important that you have a neurologist or a movement disorders specialist that's really providing evidence of your diagnosis, so that you don't have any hiccups in that process. I listed some of the documents that you might be required to have. There is a link in this slide about the information. There is a starting kit with information that you need to have when you apply for Social Security. If you're going to an interview, there is information that you need, hopefully you need to have ahead of time so that you're not wasting time with back and forth. Okay, so um, being organized in this process, being acting in a timely manner, it's really important so that things can go smoothly. There is a telephone number as well. You can call and request an appointment. There is a link on this slide as to where to find your local Social Security office to apply in person. Okay. Um, Another resource that is helpful to know is, in this case, New Jersey. I know we have people here from New York, Pennsylvania, and other areas, but the FMLA, the New Jersey Family Leave Act, grant employees time off from work so they can take care of their loved ones with a serious or significant disability or illness. So there are certain requirements, but it is by law it needs to be provided, and all you have to do is apply. Um, there are specifics about what type of employers will provide FMLA in this slide. So 50 or more employers anywhere must comply with the New Jersey Family Law. And there are a certain amount of hours that have to be met. So 1,000 hours within that year have to be met of working hours for you to get FMLA. So it is a good resource while you are, as a caregiver, if you're trying to get time away from work, well, you do all this planning and strategic planning and implementation of these services, sometime that you can buy off from work to take care of things until long-term decisions are being made. In New York, there is an FLA law, as well as in Pennsylvania. So it's good to know. Um, Another resource is Medicaid. So Medicaid, as some of you may know, is really based on financial eligibility. So not everybody is eligible for Medicaid. However, when we're applying for long-term care, it's important to determine when can I maybe become eligible for FMLA. If I'm thinking about um, here in 5 years, knowing the progression of the disease, what are my goals in terms of permanency? Am I going to stay home and be cared for at home? Do I need maybe a higher level of care? So these are conversations that we need to have with family, that we need to have with our physicians, and then plan financially. So Medicaid can be an option, and Medicaid covers services such as hospital services, doctor visits, prescriptions, nursing home care, and they have specific programs under Medicaid, such as the MLTSS, which is the Management Long-Term Care Services and Support. MLTSS is also present in New York and Philadelphia, Pennsylvania. And MLTSS, their goal is to be able to provide home permanency for as long as possible, right? So if you qualify for Medicaid, you apply for MLTSS and you're eligible for MLTSS, you can get extended hours of home care, which is something that you don't get under Medicare benefits. Medicare benefits, you can get home care, but the hours are a lot more limited. I'm sure that if you have some care, you have experienced that already. But if you are able to get into MLTSS, there are a lot more services that come into place, including nursing care, physical therapy, occupational therapy, and everything else. Um, Knowing your resources again, planning ahead, durable medical equipment. We know that we're going to need equipment to help us continue maintain a level of independence. So these are items uh, that are primarily and customarily used to serve a medical purpose. Medical equipment is covered under Medicare Part B. Medicare covers 80%, and then you pay 20% of whatever Medicare doesn't cover. So if you have secondary insurance or if you have Medicaid, that 20% should be covered by those other means. Your medical doctor needs to be able to prescribe the medical equipment that you need. It has to be documented so it can be approved. And for a complete list of the DMEs that Medicare cover, you can visit their website. This is a very comprehensive list. It's there on the slide. And I'll suggest you go there just to make sure that you're getting covered for what you need. So there is also the need for assistive technology. So what is the difference? So assistive technology is an item or piece of or equipment that is acquired, whether it's commercially, is modified or customized, that is used in increase and maintain or improve the functional abilities of individuals. The DMEs is considered a subset of a assistive technology device. So why is that important to know? Because it has to do with coverage and funding. So if your assistive technology device is considered to be a durable medical equipment, it goes under the Medicare guidelines. Private insurance covers, they need to follow the same guidelines as Medicare. Most of them should be. There can be variations. So if you have private insurance, you do have to check with them to see what's covered and what's not. But if you have that list of Medicare durable medical equipment that they cover, your private insurance should be able to cover the same. So if your assistive technology device is listed as one of those, it's a possibility that it can be covered under Medicare. So it's something to look at. There are devices for speech and language that are available to manage everyday tasks and communicate, for you to communicate with caregivers as your ability to speak declines. So those are important to look into. I listed up many resources on speech and language AT equipment, personal voice amplifiers, oral hygiene products that can be helpful. So this is places where you can get and get information. I know there are a lot of websites here, but this is all going to be on the MSA New Jersey website. So feel free to go back there. Just have to click on the link and be able to see what's available and explore them. check check with your health insurance company and see some of these are covered under their policy. So there is again adapted devices for utensils for eating and drinking. A lot of resources here. Planning ahead, advanced care planning. So most of you, I'm sure, know what this is. And advanced care planning is making plans about the health care you want during a serious medical illness. So it's talking to your family and your healthcare providers about what your wants are in healthcare, about your choices. Hopefully, these are conversations that we're having early on, and that we're not waiting last minute to decide what type of care you want in the event that you can no longer verbalize those wishes. And the advanced directives, which are part of the advanced care planning, such as the durable power of attorneys or hair care proxy, are documents. So these are wishes that you can put in writing. These you can choose a healthcare proxy to be able to voice your wishes for you in the event that you cannot. So make sure that when you choose that person who's going to be voicing your healthcare wishes, that that person feels comfortable in having conversations with your physicians about those type of topics. It is your life, and you can still have control of it, of what you want. So it is very important that we start doing this as soon as possible. The living will and instructions care directive is pretty much that document in writing with the specifics on healthcare wishes. You can have access to those documents online as well. Your physician should have them available to you. And these are documents that should travel with you so that if you have a hospitalization, the hospital should have copies of these documents. Your family should be aware where to find these documents so that they can use them when in time of need of an emergency. There is also the Pulse. So Pulse is a healthcare planning tool as well. And what the Pulse does is a medical order. The Pulse is a document that you make or that you complete with your medical provider. When you're doing a durable medical a durable power of attorney or healthcare proxy, those are documents you can do on your own. When you're doing a pulse, you're actually sitting down with your physician and you're planning your medical preferences so that if you have a medical emergency at home and you have already given orders that you don't want to be resuscitated in the event that you need to be resuscitated or rescued, then if that order you have it handy and is at home with you, EMS, whoever is coming to help you at home, will have that order already in writing so that there is no discussion at that point as to what needs to be done. There is already a medical order there. So they're not going to make you go through um, things such as CPR, which can be very upsetting and hurt more than help sometimes. And they can make those things that can be very uncomfortable if you already know that you don't want heroic measures and things like that. So important to look at this document with your physician and determine if it's right for you. Um, for all these advanced care planning issues and for estate planning, which is also important to have in mind, your assets. If you like to leave some money, your house, to family members, have all that in order as well to prevent conflict, at a time of crisis, to prevent misunderstandings. Go and speak to a elder care attorney. They can guide you as to what that process is, what documents you need, and kind of put that plan, put it together with you so that you can feel a sense of relief that it's done. I don't have to worry about it, and you can move on with the daily things that you want to do. Um, Part of the advanced care planning is knowing about palliative care, hospice care services. There was somebody outside, he's not here any longer, that talked about these two options. Palliative care is a wonderful tool. It provides support to the person with the condition, as well as to family members. They focus on comfort measures, that you can still get treatment, you can still go to the hospital, but they're managing symptoms. So it's a great group of people. It could be a nurse, it could be a social worker, you can get pastoral care, whatever it is that you need at that moment to address the emotional and physiological needs. If you have pain, whatever it is that you're going through. Palliative care can then also transition into hospice care. Hospice care, there is certain criteria for hospice care. Typically, the life expectancy should be 6 months or less. However, we have heard here, and I have heard in many instances, people go in and out of hospice, right? Because people's life expectancy are never written in a stone. We don't know. But you can benefit from the services of hospice care early on in your condition, so that you can get that benefit of management of symptoms and get the support that you need. So don't be afraid to approach palliative care services early on. Don't be afraid of the word hospice. It doesn't mean that this is it. Nobody knows, but it is that added support that you can have. And then if you're well and you want to take the trip that you were planning for, then hospice stops. You go to your trip, you come back, and then you think about it again. So important resources to talk about with your family members and to have at hand, or just have conversations with a home care provider that has hospice or palliative care, and know how to get these services when you need them. So methods and skills. When I was thinking about methods and skills, I said, well, so how do we get all this? How do we do this strategic planning? How do we do this strategic planning? How can we be successful about it? And really, it all comes to communication. How the way we do things, the way that we deliver the messages, the way we advocate for our needs. It all comes to communication. And when we talk about that, I found this quote by George Bernard Shaw. He was an Irish playwright, critic, a political activist from the 1880s. How did I come across him? I don't know. But I just did. And he said the single biggest problem in communication is the illusion that it has occurred. It happens all the time. We go to see our physician, we sit down, the physician swears they're doing a great job and they said everything they needed to say in 15 minutes, and that was a great visit. And you live there and you had no idea what happened. You 1,000 questions were and left answering, and really there was no communication. Maybe you got a few things, but you're not satisfied, right? So um, it is important that you are aware of your communication style. So again, we go. I was happy that Dr. Culture was talking about a little bit about mindfulness today, and meditation and centering yourself, because it all comes to awareness, right? How do I communicate? Um, so know what the things that you're doing. Maybe you're not a good listener. Maybe you know that you're listening to me now, but maybe you're thinking about what you're gonna make for dinner. So it's know what your mistakes can be. Choose your words and actions wisely. So also know who you're talking to. So for example, my grandmother, she needs hearing aids, and I'm talking to her. I'm telling her we're going to see my sister, but I'm also cooking dinner. So, Grandma, remember, we're going to see my sister tomorrow, right? So, my grandmother, maybe she heard me say, "Remember, did you remember to take a shower today?" Maybe that's what she heard, and she's gonna say yes. So I'm thinking she knows we're going to see my sister tomorrow. That never really, that message never got across to her. So it's my error in communication. I know I'm talking to my grandmother who has hearing aids and her hearing is impaired. So most likely the best way for me to communicate is to be face to face and have a direct communication with her, so that I know the message is being sent across. So choose your words and actions wisely. Know who you're talking to so that you can deliver the message in a way that is understood. Check in when you're talking to each other, when you're talking about these important decisions about advanced care planning. check in with the other person. So what I heard you said was that in the event this happens to you, you don't want me to call this person, you don't want me to do ABC, you want me to do this for you. Check in, make sure that you are in the same page. So there are different types of communication, and communication is a subject that there could be a whole uh, conference about, of course. But I just brought two types in because I think these are important. Assertive communication is the communication you want to use when you're out there advocating for yourself, when you are talking to your doctors, when you're talking to your health insurance companies, when you know that you need to get something and you need to get across. It's not aggressive. The moment we become aggressive, people most likely would stop listening. Oh, I don't want to deal with her. I don't want to deal with him. They're going to start yelling. So it's not aggression. It is honest. It is open. It shares your feelings and thoughts. You create statements that are clear, statements that are direct. It doesn't blame or accuse anybody, and uses I messages, right? So, how do you communicate assertively? You describe the situation. For instance, um, my mother relies on me to transport her to medical appointments. It didn't happen. She had a medical appointment and she never went. My sister comes in. I'm sort of relying on my sister to be my backup. She was never my backup. So I'm very upset. So if I wasn't using assertive communication, my sister will come in and I will say, you were not here to take my mother to the doctor. So she missed the appointment because, of course, you expect me to do everything, right? So that's when my sister is ready to fight with me, right? So she's ready to fight. And then communication is really not effective. If I was to say, you know what, my mom missed her appointment today, that's my situation. I wasn't able to get her there. I did call you and I couldn't get a hold of you. I thought you were going to be available today. So unfortunately, she didn't go. That made me feel really frustrated and upset because I know that she needs her medical care. So, next time, what do you think if we sit together with our calendars and then I become specific and we set up, put together the dates of my mom's medical appointments and we make clear that this month you and I have a specific dates in which either you and I will transport her. Because if we don't do that, the consequence if we don't do that, my mom will continue to deteriorate. She's not going to get the care that she needs, right? So that's assertive communication. You are starting with an I statement. You're clearly expressing the situation. You are already offering a solution. You are giving the other person the possibility to relay back to you, and then you're spelling the consequences of that. So that's a motivator. If we don't do this, this will happen. Knowing the consequences can motivate us to have a better system and develop a better system. So those communications are really important when you talk to your doctor. You know, when I come to the office um, and I feel that you're not listening to me, I guess that I'm not getting my point across and I'm not getting what I need from you. So those are communications that you need to have so that you can get what you want and what you need out of an exchange. The other type of communication is the name I found was Aikido, which comes with a school of martial arts, and you'll find by the definition why. But this communication is about finding common ground. So you want to be able, and this communication is really great when we're talking to our family members, when we're having those difficult conversations about advanced directives, wishes of healthcare, your future, right? Financial situations. You want to be able to align, put yourself in the other person's shoes. Is guided by energy. If I know my mom is upset, being able to acknowledge and see that she's upset. It's about empathy when you're aligning yourself with that person so that you can listen carefully, you can ask for clarification if necessary, so you can be there with that person, understanding where they're coming from. It's empathy, the alignment piece. Then you can find areas where you're agreeing. When you understand what's going on with that person, why you are upset. Maybe I agree that you're right. The fact that we missed your medical appointment again is a reason for you to be upset. I agree with that. And then you find that common ground. Once you do that, you're able to begin to problem solve. You're redirecting. You're taking that moment and you team up together and you find ways to find a resolution, right? So instead of you acting angry because you don't understand why the other person is angry and begin an argument that's going to take you nowhere, you look for empathy. You decide to stop before you react. So it's more about taking a moment, understanding what's going on, and responding versus reacting. And then you can resolve, again, using the I messages, which we use in the assertive communication style. So you want to be able to agree to disagree about certain things, but be able to find a resolution as well. So this goes well throughout all the stages of this condition of the disease when we're handling neurodegenerative diseases, because we're going through changes. We're going through, every day is going to be a different day, right? We can't predict what's going to happen tomorrow. We know that there are going to be new needs. So when we talk about methods and skills as well, we're talking about learning to manage those changes. And because of the nature of the condition, these are a lot of cognitive changes are going on. So identify the needs, understand what's bothering you most, rank the needs together as a family, rank your needs, develop a plan, find ways to cope with those changes. So for instance, with cognitive changes, we all heard the doctors, right? It's so important to stay physically active. It's so important to stay mentally and socially active. Be out there, get involved, keep this mind working, keep this mind occupied, keep this mind creating. It's very important. Establish a routine and keep a planner. We carry so much in our brains every day. We have 1,000 things going on, right? If they're all up here, it becomes overwhelming. If you have a system where you can plan your days, when you can plan your weeks with something that you can see, that you can manipulate, it becomes more manageable. Maybe, yes, it's still somewhat overwhelming because you see everything that's on your plate, but at least you know you can change some things. If it's a day that's too heavy for you, then maybe prioritize. Do I really need to do all this in one day? Maybe not, right? So changing, being able to be flexible that way through the use of a planner is very important. Addressing the neuropsychological changes. So we need to compromise. We need to choose our battles. If your loved one doesn't feel like taking a bath or a shower today, so what, right? Are we gonna argue because of that? You're just very fatigued. You might not want to do it. So, is it the end of the world? Of the world? No. So, choose your battles wisely. Acknowledge, redirect, refrain from arguing. Again, it's quality of life, right? So we're trying to find middle ground. Um, Support group involvement. Why is that here? Because when you join a support group, and we'll be talking about our support groups all throughout the day, you find a common ground among the support group members. You find that there is other people that are going through the same challenges, through similar challenges. We learn through each other. So we're supporting those neuropsychological changes that way. And then also talk to your neurologist. I'm going through terrible apathy, fatigue. What can I have? What can I, in terms of pharmacological interventions, what can I take that can help me with that fatigue? Um, Motor changes, managing those motor changes. We have use your physical therapies, use your occupational therapy, use your DMEs, your assistive technology, use the resources that you have at hand so that you can remain as independent and as functional as you can. That's the goal, quality of life. So that the things that are important to you, hopefully, you can continue to do for as long as possible. Speech and swallowing, we talked about that a lot with Dr. Dupree, Dr. Colbert. Am I pronouncing her? Culture? Thank you. Culture today. And, they talk about all the options. We talk about sleep. Do we need a sleep study? Um, talk about quality of life issues and related to PEG tubes and feeding tubes. Those are changes that most likely will come. So it's important to discuss those changes early. Um, I put a small note at the bottom of the slide. Some of this information I got from Cure PSP guidebook. Cure PSP is really a partner organization. They're really being fantastic in working with the MSA community, and they have created this guidebook that has very specific information on MSA. So it's a good resource, and that's why if you have time to go in there or order it for you to have at hand. And then quotes. I love these quotes. I think they're real. And these quotes, oh, I didn't say from whom. So this is from Stephen Hawking, who passed away. And my advice to other disabled people will be concentrate on things your disability doesn't prevent you doing well. And don't regret the things it interferes with. Don't be disabled in a spirit as well as physically. So that concludes a lot of the things that we have talked about here. It's this is not a death sentence, it's life, and we have to continue to live life to the fullest despite of all the challenges it brings. We know life is hard, that's a fact, but we need to keep our head up, and we need to keep moving, and we need to keep planning, and we need to keep having fun. So embrace your family, and plan for that. Bring the music therapist, dance, sing, do whatever you like. So that was a beautiful one. And then the other quote is, intelligence is the ability to adapt to change. And the last part of this conversation we had today was adapting to change. Adapting to change through interventions by providers, whether they're medical providers, whether they're other therapists in your life, helping you through those changes, and through addressing changes in cognitive abilities. That comes with the communication piece. How can we reach that common ground? That's essential. So we will find the intelligence to find the ability to change. It's not easy, but it's in us. We just need to find it. That's it. And this is my contact information. And if you have any questions, I'm gonna stay here for that. The Social Security disability, the first thing is there is a compassionate allowance. So once you apply to Social Security disability, you should be able to get it in a short amount of time. But what I mean, weeks. As short as 2 weeks, as long as 2 months, that's the break they give you. So to apply, because the first thing that they do when the case manager for Social Security, hopefully the first thing that they should be doing is looking at that list of compassionate allowances. So when they see the disability, the first thing they do is sit in the compassionate allowance list, and then that's how they get to process everything fast. So it is key though for you to be able to provide all the information you need ahead of time. Have and then when they request those medical records from your doctor, and they said we requested those, please follow up with your physician's offices. Make sure they receive the request. Make sure they send them out, because sometimes people get denied for silly things. We never got the paperwork or something like that. So it requires consistency in follow up. Thank you very much, everybody.
Victoria, thank you.
Thank you.